In this video, we are going to do 4 exercises to realign a problematic hip position that's causing hip pain. So if you have a functional hip, the ball and socket joint of your hip should be able to move about pretty easily. So your femur, which is your upper leg bone, should be able to move within that socket joint of your pelvis. Well, when your femur starts to lose that ability, this kind of adheses together, and so now you have to move your entire pelvis because the femur doesn't move independently. So we want to try to get that independent movement back. So in your self-assessment, if you saw that your hip was rotating forward on one side or another and you have hip pain, this sequence is probably going to help you, because we're really focusing on bringing the flexion, which is bringing your leg forward on a step, flexion and extension, bringing your leg back on a step. We're trying to bring that back together. So we're going to start with a counter stretch. So I have a block up here on a chair. Now you can use a regular counter, that's why it's called counter stretch. But you're going to stretch your arms out long, hands placed on top of this counter. Walk your legs back so your toes or your ankles are right below your hips here. You can see how I'm making a straight line. My feet aren't way far forward and my butt's sticking out. They're not way far back. All right. So you're going to feel like your weight is almost in your toes here. Now your elbows are stretched out, and then you're going to drop your pelvis. You're going to tilt your pelvis forward, stick your tailbone up into the sky, relax your stomach muscles. We're going to hold this position for about 1 minute. You want your quads tight here and your knees straight, so the knees are locked out. Now, if you're not flexible enough to get down into this position, you can do it with a taller counter, like this, all right? I just didn't have anything to place that in there. Excellent, so breathe into it. Keep tilting that pelvis up to the sky, so you're tilting your pelvis forward. You're probably gonna feel a big stretch in your arms too. Good. Weight still in the toes, quads tight. Excellent. Go ahead and come out of it. So you can do the counter stretch with your hands on the wall. All you have to do differently is put your hands flat on the wall, spread your fingers out, and use that as your surface instead of a counter or a chair and block like mine. So unfortunately, my setup's not set up for this exercise, so you won't be able to see my back, but I'm going to pretend the wall is here. Same thing, I just bend forward like that, and then you can walk up the wall if you need to. So if you're not super flexible, you can come up here. If you're flexible, you can come down here. Find what works for you for that one. So for our next exercise, we are going to do sitting floor. Now I'm going to show you the version without the wall, and then I'm going to go up against the wall so you can see the side version. We're going to stretch our legs out long, feet parallel, pointed straight, toes up to the ceiling. Pull those toes back so you can really feel those shins burning. Now you're going to roll your pelvis forward on your sits bones. So very similar to what we just did in the counter stretch, where you relax your stomach and you let your pelvis go forward. Now you're going to keep your shoulders stacked on top of your hips here, so you're creating this nice S-curve within the spine. All right, so I'm going to go ahead and do that up against the wall here. So you can see my feet are pointing straight. I'm rolling that pelvis forward. Your shoulder blades are on the wall. Your head is on the wall if that's comfortable. I'm going to go ahead and start our timer. We're going to try to hold this for 3 minutes. You can relax your palms up on your legs here. Just kind of take note of where your knees are, where your kneecaps are, if one side is pointing a different direction than another. That's a femur disparity kind of showing up in your legs, which can also cause hip pain. So this exercise specifically is working on making that femur disparity equal. and engaging your hip flexors equally so one knee doesn't tip inward or outward more than another. So just remember to breathe while you're in this position. Good. Keep pulling those toes back. Keep slightly pinching your shoulder blades. So if I was there with you and I tried to slide my hand behind your lower back, I could actually slide my hand back there because there's some space. Good. Are we starting to feel our quads? Because our quads are tight. You might be starting to feel this in your groin a little bit. Could be feeling it in your upper back, mid back. I'm going to give a challenge. If this is super easy for you, then I'm going to give you a challenge with the upper body. If this is challenging enough, just stay here and hold it for the rest of the time we have. But if you want a little bit of an upper body challenge, keep that back position, keep that pelvis rolled forward, make that golfer grip with your hands here. You're going to bring your pointer finger to your temple. You're going to open your elbows up, keeping your shoulder blades on the wall. We're going to curl our elbows together. If they can touch, awesome. If they can't, that's okay. You don't have to go all the way together. But remember, we're keeping that long back position, that pelvis rolled forward. We're moving back and forth. Again, this is a little advancement. If this is the first time doing this video, I would not suggest you do this advancement. I want you to focus on the legs. So we're really linking up the ankles, knees, hips, and shoulders again, so your hip can work independently and not be kind of stuck together. We want to feel like we're moving our pelvis over our leg bones here. Good. Don't forget to breathe. And take breaks as you need it. Excellent. We got a few more. We're almost done with this hold. Keep those toes pulled back here. Keep those feet slightly pigeon-toed. Oh, saved by the timer. So after we got your hip flexors working and your ankles, knees, and hips and shoulders all linked up, and we did a little bit of work with the back, we are going to relax it all out in static back. So grab your chair or your block. We're going to lay our legs up at 90 degrees here. Whew, that's going to feel good after that last one. And you just get to relax here. We're going to relax here together for 5 minutes. Palms facing up here. Just know if this feels different, if you've done any of my other videos, if this position feels different after we did that last one, after we did that sitting floor. So I personally feel like my pelvis is a little bit more arched than it normally is, and going into this position feels really good on the lower back. So here we're really focused on bringing the pelvis back into the proper alignment, because remember at the beginning when I told you that the hip and the pelvis have to work independently from each other to be able to function fully. So we really worked on getting that hip flexor engagement, getting that flexion in the hip to realign the pelvis, but now we're going to have to work on letting the back go, because oftentimes when you have hip pain, it comes with back pain as well, because the back ends up compensating and overworking because the hip is not functioning properly. So here we get to actually relax and let our pelvis and our back fall back into a more neutral position. Good. I want you to really focus on your breath here. Try to breathe into your lower rib cage. Feel those lower ribs expanding from the sides. You can even put your hands on the side of your rib cage here. And feel like the lower part kind of expands into your hands. Shoulders stay completely relaxed. Feel your lower back just melt into the floor as you really breathe into your lower rib cage, into your diaphragm. Sometimes I like to put my hands on my diaphragm, which is right above your belly button or right below your ribs, to feel this expand. You can feel your lower back relaxing. Breathing in through the nose, out through the mouth. Relaxing a little bit more. Just taking a moment for yourself. Do a full body scan. Make sure you're not holding any tension anywhere in your body. Especially in those shoulders. Let gravity pull them back down to the earth. Excellent job. So now that static back is coming to an end, you obviously can stay here for longer, especially if you feel like your back hasn't fully settled into the ground. But our next exercise is actually going to be supine groin stretch, which is another one that we lay on our back and focus on our lower back settling. So even if you're not fully settled in this position, you could potentially go into the next one now, because we're going to focus a little bit more on settling our back. So my friends, this next one we are going to be doing supine groin stretch. So if you're unfamiliar with the supine groin exercises, I would recommend to go watch the tower video. If you have a tower, we're going to do this on the bottom rung of the tower. If not, as you can see, I have a bolster here to prop up my straight foot. My foot's going to stay on the ground, and just make sure you have something pretty solid to keep your foot facing up towards the sky so it can't fall out like this, because that's going to defeat the purpose of the exercise. So grab your block. You're going to lift one leg up on the block, just like we had it in our static back. Lay back here, and then that leg that's out long is still propped up here with this bolster. Or you can use a wall, you can use whatever you have to prop your leg up there. A couch. So now we're just going to relax here. Preferably you would do this 15 minutes on both sides. You can do it less than that. You can do 10 minutes on both sides, but you're going to get more benefit obviously if you do 15 minutes on both sides. And even when you just get into this, can you feel your hips starting to stretch? So we do a lot of the supine groin exercises to get full extension of our hip joints. So the other exercises, we're really focused on getting that flexion of the hip, getting that hip flexor engagement. Then with the static back, we were working on relaxing our pelvis to a more neutral position. In this one, we are also working on relaxing our pelvis into a neutral position, but also getting that hip extension and getting our psoas, which is our major hip flexor muscle, back to its proper length. So go ahead and lay here for 15 minutes. I want you to switch over to the other side after 15 minutes. So go ahead and pause this video, and I will see you for our last exercise. So I hope your hips are feeling amazing after that supine groin stretch. Hopefully you were able to hold it for the full length, but if not, you can always try again tomorrow. So for our last exercise, we're gonna solidify everything that we've done with an air bench. So I want you to bring your feet parallel, lean up against the wall. You're gonna walk your feet out, bend your knees, drop your butt down on the wall. Now the most important part here is I want you to press your lower back against that wall. So if I was there with you this time and I went to slide my hand behind your back, there would be no room. It would be absolutely flush against that wall. All right, if this bothers any knees out there, you can come up a little bit higher on the wall. All right, you don't have to be fully parallel with the ground. You do want this to be more at 100-degree angle instead of a 90-degree angle. You should be able to see your toes over your knees here so they're not, your ankles aren't directly under your knees, but they're a little bit further out. All right, so we're gonna hold this for a minute. You can work your way up to 2 minutes or even 3 minutes, whatever's comfortable for you. Now, if this is already a super big challenge, then just do 15 seconds of it. Much rather you get lower in the wall, do 15 seconds, and that's about it. You can see my quads are like, no, we don't want to be that low today. So we got a couple more seconds left. Make sure you're pressing that lower back into the wall. Back is flush. Excellent. Go ahead and bring your hands behind you. Push yourself off the wall. Excellent job, my friends. So like I said, you can work your way up to 2 minutes, or you can start at 30 seconds on that last one. The form is the most important thing. I don't really care how long you hold the exercise. All right, so hopefully this made your hips feel a little bit looser, a little bit more mobile, and a little less painful. So now you can start to feel like you don't have to swing your hip forward or your pelvis forward every time you take a step. Now your leg actually can extend behind you and flex forward. All right, I'll see you in the next video.